Hi, my name is Martina Bito. I'm a nutritionist working as an associate professor at the Faculty of Food Technology and Biotechnology University of Zagreb. I'm looking forward to present you as a member of Zagreb team the results of our pilot school meal initiative using schools with gardens. In this small pilot study, our goal was to establish an effective strategy to support school food procurement policy to improve children's uptake and long-term acceptance of nutritious school meals. Schools, where children spend up to 8 hours a day, play an important role in children's nutrition. Eating habits adopted in childhood are often maintained in adulthood, so it is important to expose children to foods with a positive impact on health and teach them proper food choices. Our first aim was to explore benefits of school gardens on school meal nutrition and children awareness and acceptance of healthy eating habits to fill up a gap. School gardens are a promising tool to improve vegetable intake among children because they increase students' exposure to fruits and vegetables, which may positively impact eating habits. We were able to locate 7 schools with gardens in Zagreb and 7 schools without garden to compare with. To compare these two sets of schools, we did some baseline data collection. First, we analyzed school meals nutrition. We collected 1-year school menus. The nutritive value of school menus were calculated using national composition tables. Those menus were further analyzed by type, quantity, and frequency of offered fruit and vegetables. Furthermore, we look into children's eating habits. Therefore, we have collected plate waste for 5 consecutive days during 2 seasons after lunch meal. The leftovers were separated in 6 different bins. In parallel with plate waste measurement, we also asked students about their food preferences and reasons for not finishing their meals. Results of those baseline data regarding school meal nutrition reveal that a large proportion of daily school menus from both types of schools are not nutritious according to national recommendation. The biggest problem is that half of the school menus in both types of schools offer meals with a lower energy value, worryingly low content of fiber, and excessive saturated fat content. Results of this research were also alarming in terms of fruit and vegetables quantity in school meals. School menus offer only 55% in schools with garden and 69% in schools without garden of the recommended amount of fruit and vegetable. The results of research on plate waste were alarming in terms of plate waste level. Surprisingly, our analysis indicates that schools with garden have a higher plate waste level than schools without garden. Vegetables were the most wasted category in both schools. Research on preference toward vegetable dishes revealed some small differences between those two types of schools, but we believe that these findings were not a consequence of a garden existence. It may be that the presence of a school garden is insufficient and that more active and regular engagement is required to elicit attitudinal changes. In order to resolve this problem, we contacted the City of Zagreb office and proposed our recommendation. Since they show understanding and support, in June 2019, a school menus committee was established with 15 members, including nutritionists, medical doctor, an economist, as well as professionals from the Institute of Public Health and school representatives. The main task of this committee are to create and implement new menus adapted to each kitchen infrastructure, coordination of activities related to the education of staff in charge of food preparation in primary schools in the city of Zagreb, and monitoring, controlling, and evaluation of the application of new menus. The second aim of this study was to improve the nutritional awareness and eating habits of children. For this purpose, a nutritional intervention was induced in both types of schools. The nutritional intervention included education and nutritional improvement of school menus. We recruited children from first grade. In every school, the classes were divided as intervention and control group. For the intervention group, education were delivered through workshops and games. Education also included parents, therefore an official website was developed and used to promote adequate nutrition. All educational materials were designed and prepared by the Zagreb team. Education was focused on postulates of a healthy diet, raising awareness of the importance of fruit and vegetable consumption, and consumption of seasonal, organic, and local fruits and vegetables. During nutritional education, students participated in creating educational posters which were used to decorate classrooms for the purpose of visual stimulation. Students were also encouraged to taste new foods and dishes at home. The nutritional intervention also included nutritional improvement of school menus, as I mentioned previously. We proposed about 40 new dishes, but I have to say implementation was very challenging. Due to huge difference in school kitchens, it was not possible to propose the same meals for all kitchens in Zagreb. But we were able to increase the amount of vegetables and fruit in certain dishes. This modification toward more nutritious and healthier food dishes need to be implemented very slowly to avoid dissatisfied children and parents. Therefore, this activity is still ongoing in our schools. At the end, from this study, several policy recommendations can be drawn. First, school food policy procurement needs to be improved, and in line with that, healthier options meals should be offered in school kitchens. Food policy procurement could be improved by connecting schools management with small local or family producers of fruit and vegetables. Furthermore, it is highly recommended that a professional staff like nutritionist profile person is involved in the planning of school menus. Second, nutrition education and promoting healthy food choices are necessary to support long-term acceptance of nutrition school meals. Children, parents, cooks, and teachers should be all more educated about the importance of healthy eating. Changing fruit and vegetable consumption in children is complex. School-based vegetable gardens are a promising tool to improve knowledge and preference. However, we believe a holistic approach and collaboration are needed so that schools that do have gardens should better use those gardens for improving children's eating habits. The recommendation is to increase the popularity of school gardens and to grow some familiar food, such as cherry tomatoes or blueberries. These could improve children's knowledge and overcome neophobia toward fruits and vegetables. Thank you for your attention. If you have any question regarding this topic, do not hesitate to contact us.